as we wind down from these winter months and look forward to, the inklings of spring, a lot of people aren't just tired of the cold, they're struggling with their mood too.
Mental health experts say seasonal depression or seasonal affective disorder is more than just winter blues and can hit everything from your sleep to your energy to even your motivation. So joining us now to help us understand all of this is Dr. Renee Exelberg. She's a licensed psychologist and founder of the Metamorphosis Center for Psychological and Physical Change. And Dr. Eugene Lipov is one of the world's leading experts on the physical consequences of trauma and chief medical officer at the Mental Health Group. Welcome to you both. Appreciate your joining us. Well, it was a tough week for a lot of people in the Northeast and around the country. So I'm going to start with you first, Dr. Exelberg. Explain for us how seasonal depression is actually a real mental condition, not just maybe the winter blues.
I think so many people can relate to this idea of winter blues. It's about 20% of the population that has what we call a subclinical seasonal affective feeling, but it's really only 5% of the population that actually characterizes this seasonal affective disorder, which is a psychiatric term for recurrent depression that is influenced by seasons and the lack of light. And it can cause real depressive symptoms, lack of motivation, poor concentration. We often see with this a weight gain, increased sleep, and other things about hopelessness and even suicidal ideation.
Interesting, Dr. Lipov. The thing is that I've heard for decades about the seasonal depression in areas like Alaska and let's say Seattle, where there's a high level of depression, higher levels of domestic violence and alcohol abuse. The list goes on and on and on. But are we actually seeing a rise in seasonal depression in, let's say, places like the East Coast?
Well,
I think that.
I'm sorry. You go ahead.
No, it's Dr. Lipov.
I'm not sure about the rise, but clearly the farther north you go, the higher the percentage. Mm-hmm. So seasonal affective disorders, actually, a cute term for that is SAD, S-A-D. It's 1.2% or 2% in the southern regions and up to 9% higher up. So the farther you go, the less light, it changes your biology. So to me, all psychiatry or psychology is biology. What happens is you need the right amount of light to feel good. And as this light goes down, your serotonin goes down. It makes you feel sad and blue. And when it's severe enough, it starts to recycle, and it affects women 3 to 4 times more than men, right? And if somebody has a history of PTSD, or post-traumatic stress disorder, topic I know quite a bit about, that also makes it worse. So that's why people need to really take it seriously. As the psychology lady told us, it can be suicidal ideation, meaning it could lead to suicide.
Yeah, this is, as we said up top, it's more than the winter blues. Dr. Exelberg, can you also explain more? I mean, what's happening to the brain during that period that causes this? And are there any signs that people should look out for? Because yes, of course, you're feeling more depressed, feeling sad, but is there anything specific that people can say, okay, this is what it is?
Yeah, I mean, we definitely see disruptions in the circadian rhythm, and that changes our hormones. So the hormone serotonin, which is responsible for uplifting our mood, that is decreased, and melatonin, which makes us sleepy, is increased. And so one of the things that we want to look for is general mood. Often, people say that they feel, down, that the weather is causing them to feel down, but we're really talking about much more of a severe depression. And obviously, people who have experienced depression before, they want to be much more alert. Young people, this really affects everybody, but it's primarily 18 to 30, and definitely increased statistically for women and young people. So we want to look for those signs that we see with more depression, lack of motivation, really not wanting to get out of bed, feeling hopeless. And then in terms of like this particularly, this craving for carbohydrates, eating more, sleeping excessively. And we also want to really look out for the screens. Social media makes this even worse because particularly with young people, they're staying on their screens at night, and the screens are actually impacting the melatonin, causing them to feel even more tired. So clearly shutting the electronics off at night.
That's a very good idea. In fact, I'll take that advice. But Dr. Lipov, the thing is that, many people are calling it seasonal depression, and that's exactly what it is. But I want to throw a hypothetical at you. Let's say it's summertime, and generally there's more light during the summer, but I recall years where there was a lot of rain, a lot of overcast, even during the summer, and that changed a lot of people's moods. Mm-hmm. So even during the summer, people can be impacted, yes or no?
Absolutely. So, well, there are two things I'd like to point out. Before we get into that, I'd like to kind of go back to seasonal SAD. So where you have to be very careful is when people do not stop not getting out of bed and become really disabled. That's a big sign not to miss, because that could lead to massive problems. As far as overcast sun, if the key point is basic sleep hygiene is what people talk about. That involves, as soon as you get up, ideally what you want to do is go outside. Even if it's overcast, you're still getting a lot of light, a lot of light during the summer. So yes, it can affect you, but not as much as you'd think. But the other thing to think about also, even in the winter, you need to try to get outside if you can, but you have multi-spectrum lights. You can have light sources specifically designed to address SAD. So that's something you want to think about. But to give you a specific answer, yes, it does affect you, but not as much as you think. You need to get outside so you don't have a window or glass blocking the light. You still get tons of light, even if it's overcast.
Interesting. Awesome. Thank you for breaking that down for us.
Yeah, it does seem like people get worse too towards the end of the winter, February, March. They seem to be, because as winter begins, we're all happy, excited about the snow. There's the holiday season, and then it just drags on. But Dr. Renee, can you just tell us what are some of the underlying risk factors we should be looking out for?
As we said, like the changes in daily functioning are particularly prominent here. With people who just have this winter blues, we don't see disruptions to their daily functioning. And so we really want to be mindful of that. And there are lots of things that we can do to address this. There are things called light therapy. You can buy these lights online. There's something called a dawn stimulator, which actually is an alarm clock which simulates the sunrise about an hour to two before you wake up. Definitely want to load up on vitamin D, because when you're not getting as much light, you're not getting that vitamin D. Avoid alcohol. And once again, stay away from social media, keep social contact going, and always look out for your friends and family. Be somebody that people can talk to.
Dr. Eugene, Dr. Renee mentioned in terms of the light therapy and some other, things in terms of shutting down your phone, at least, let's say, an hour before going to bed, so that way it gives your mind the opportunity to enter into a peaceful sleep for however long you have. However, are there any other treatment techniques or ways to diagnose that you're not getting enough light?
Well, before I answer that, if I may, the recommendation is 2.5 or 2 hours before you go to sleep.
Okay.
Not an hour, because what actually you're doing, the light, when it hits your eye, it suppresses melatonin production. That's something to keep in mind. It's not that your mind is just racing. So what you want to do is, as absolutely is correct, we need to stop electronics 2 hours before solid. So read a book, something like that. The less light into your eye, the less disruption of melatonin. I think that's really important. The other thing to think about is exercise actually is a natural way to fight depression. When melatonin goes down, inflammation in the body goes up. And that inflammation by itself causes depression. So exercise, go for walks, do these kind of things like that. Deep breathing, yoga, things like that are very, very good, and they're not medicinal. The other thing that happens is that when somebody has SAD or seasonal affective disorder, things like that, serotonin gets bound up in the blood. So there's not enough serotonin. So if somebody is disabled, not able to get out of bed, and things like that, SSRIs could be life-saving. And those are medications. So the point is, there are things you can specifically do, which is really interesting, that serotonin gets sucked up in your blood in the winter.
Dr. Renee, I've seen a lot of these red light therapies on social media, although I'll be using social media less after this segment. But is there a certain one we should use? Because I'm seeing so many all over the internet, and the benefits do seem to be great in terms of what this red light can do for the brain, for the body, and things like that.
There are so many red lights out there and so many different claims about what is the most effective.
Yeah.
With seasonal affective disorder, the idea is really to expose the body to this light therapy. And there is a realm of light therapy products available. And as I mentioned, also this dawn stimulator, which is the alarm clock that simulates the light, the natural light for when you wake up. And just in terms of also, natural, also opening the blinds throughout the day to get as much light as possible.
Well, thank you both for helping us see the light on seasonal depression. We appreciate it.
Can I add one thing?
Please.
Real
Red
quickly.
light therapy is not the answer. You need multi-spectrum light. You need full light. It should be white, bright light into your face, not red light. They're very different.
Gotcha. Natural light is always better, just like food. Thank you so much.
How it's designed. Thank you.
You got it.